We want to welcome all of our Doctor of Physical Therapy, DPT for short, pathway students today. Congratulations on all of your hard work. And as a future MCPHS DPT pathway student, you're all on track to your goal of becoming a Doctor of Physical Therapy. How exciting is that? My name is Megan Lawler, and here with me I have Sarah McLaughlin, who's the Assistant Director of Recruitment from our Worcester, Mass location, and Kirsten Sjogren, current student in our program. So today we will be able to provide you with in-depth overview on your pathway program, which covers the undergraduate experience all the way through the graduate program. To start, there are many benefits to being a pathway student at MCPHS University, but first and foremost, you will have a guaranteed interview if minimum requirements are met throughout your undergraduate program. Second, the merit scholarship that you are awarded is renewable for all 6 years of the DPT pathway, which essentially means you'll see that scholarship in both your undergraduate and graduate portions of your time with us. You don't have to reapply, it's automatically renewable. So just as an overview, as a DPT pathway student, you've been accepted into an accelerated track to earn both your BS degree and your doctorate degree in a total of 6 years with a successful progression. In your pathway program, you will immediately have a healthcare focus. Students are required to complete classes like interpersonal communication for healthcare professionals, so building a rapport and relationship with the patients that you're working with, healthcare ethics, and many other core classes that are related directly back to the healthcare field. In addition to these classes, within your curriculum, you'll complete all of the pre-required classes for your graduate program. So this combination of coursework is really designed to ensure you have the academics foundation required for a rigorous graduate program. So you can be confident in knowing that you have everything you need when you get into that graduate program. The pathway to physical therapy is through one of our 3 undergraduate pathways. So you may be in one of these. These 3 pathway majors include health science, health psychology, and public health. Again, one of which you're enrolled in. These 3 undergraduate options are really designed to sharpen your analytical and critical thinking skills as you prepare to be better equipped with your patients and even people who you're working with in the field. If you have any questions at all about which undergraduate pathway track you've been admitted to, or you want to reconsider your choice, please schedule a time to meet with us so that we can review that major in detail with you. I wanted to ask Kirsten as well. Kirsten, how did you feel that your undergraduate major helped you to prepare for the DPT program?
I feel that my undergrad major in health psychology made me feel very prepared for the PT program. Not only did I take classes that were required for PT school, like anatomy, bio, physics, exercise phys, I also had a strong foundation in psychology. I was able to learn so much from my psychology degree that is applicable to physical therapy, such as different models for behavior change, research skills, adherence strategies, and tools to motivate patients, and also how to present myself as a strong candidate for any graduate programs or jobs through the Health Psych Seminar Series. I feel that my education in psychology will help me to be a better physical therapist, and I have felt very prepared for all of my classes and experiences so far in the DPT program.
Amazing. That's great to hear. I'm so happy to hear that for you. So, just kind of moving on, in your first year at MCPHS in Boston, in addition to your coursework, you'll be exposed to many different support services that MCPHS has to offer. So, first, in your introduction to our support structure, we normally introduce you in a course known Introduction to the Major, or as we call it, ITM. That class, again, you take in your first semester. In this class, the support that you will learn about really includes the Center of Academic Success and Enrichment. In that center, you'll have access to what we call your MAC team, MAC team. This team includes a faculty mentor from the School of Arts and Sciences, as well as an academic coach. The case assists students with general academic advising. So if you need help picking a class or moving around a class time, they're there for you. Time management skills, and also review of your study skills, talking with students in the past. Are they better studying by themselves or in a group? They really help you hone in on those skills. Don't forget that your faculty mentor is also there to offer you mentorship and guidance throughout your undergraduate years. Most of them are literally steps away in the same building you're taking classes, so they're not too hard to find. Secondly, through our Center of Professional Career Development, also known to us as the CPCD, students have access to what we call career advisors. They have workshops on topics like personal statement writing, interviewing, and finding shadowing experiences, volunteer experiences, and even patient care experiences. They also have mock interviews. So if you are a nervous interviewer like myself, it's really great because you can utilize this service in order to help you kind of prepare better for these types of interviews. So they're there for you as well. Pathway students like yourself also have an internal pathway counselor in the admissions office. This dedicated admissions counselor also works with all pathway students. They really help you to provide you with a timeline, your application guidance and planning, so you don't miss any important deadlines and you know exactly where you are in terms of classes, how you're performing, how you look as a candidate, all those types of pieces. But they also organize information sessions to ensure you're on track to achieve these goals. Kirsten, did you use any of these types of support services I just mentioned? If so, how did you utilize them?
I did. My faculty mentor was very helpful in guiding me to stay on track with my goals and give advice as far as how to best prepare myself for PT school. The CPCD was able to offer me assistance in writing a resume and provided so many useful resources. I was also able to, sorry, I'm going to redo this part. Okay. Yes, I did. My faculty mentor was very helpful in guiding me to stay on track with my goals and give advice as far as how to best prepare myself for PT school. The CPCD was able to offer me assistance in writing a resume and provided many useful resources. I was also able to utilize the Writing Center so that I could edit, revise, and proofread my personal statement for PT school. The internal pathways counselor provided presentations with the timeline and steps for the application process that were very clear and made it really easy to stay on track.
That's awesome. So happy to hear that. Again, they're offered to you throughout your entire career with us. But in your second year, you'll be working to ensure you really meet those minimum progression requirements. And historically, these progression requirements have included a 3.0 overall GPA, a 3.0 prerequisite GPA, a GRE exam or a GRE test score, as well as a recommended 10 hours of PT exposure, just to get your feet wet in the field a little bit. You'll certainly want to attend an information session hosted by the internal admissions counselor to review your class years, application timeline, and admissions requirements again. This is a free service that we offer, so it's definitely worth it to meet with them and check out some more information. But with this information, you'll be able to map out exactly when you plan to submit your graduate application. And for the DPT program in past years, students prepared and submitted that PT-CAS application over the summer between your second year and third year. So your class will be definitely given and encourage internal student deadlines, which historically are in early August. All internal applications are received by the admissions office and flagged as an internal application, so you won't get lost. We'll know exactly who you are. The application will then be reviewed based on internal admissions requirements. As I mentioned earlier, if you meet the minimum requirements, you'll be invited to interview for the graduate program. So exciting. Interviews typically take place in the fall and early spring of the pathway student's third year. So it's something to look forward to after you've done a lot of hard work. And based on your interview, academic record, and application requirements, you'll be reviewed by the faculty admissions committee for admission into the graduate program. If you're accepted, you'll have a set amount of time to submit your enrollment deposit and commit to the program. From there, All you really have to do is finish up your third year undergraduate coursework strong and officially make a transition into the graduate program on the Worcester, Mass campus at the end of your third year. So, just out of curiosity, Kirsten, would you mind sharing with us how your application and interview experience was? And if you look back, as an applicant, do you have any tips you could share?
Yeah, of course. Although application processes can always be a bit stressful, the resources provided at MCPHS make it much simpler. I was able to work on my application during the summer between my second and third years. And then after taking the GRE and submitting my application, personal statement, and letters of recommendation, I was invited to an interview. This interview day is really not that stressful. It includes an admissions presentation to a small group of applicants. My group consisted of other internal pathway students. And then you'll interview one on one with the DPT faculty member, which is really just a conversation so that the interviewer can get to know you a little bit better and make sure that you're a good fit for the program. It ends with a tour of the Worcester campus. Although interviews are always a bit nerve wracking, the experience was very positive and made me excited to take the next step. Everyone's super supportive throughout the whole process. My advice to students for their interview is to be prepared, but just relax and be yourself.
Awesome, great advice. Thank you so much. Now, talk a little bit more about the DPT graduate program and what you can expect during that last half of your pathway as a graduate student.
Thank you, Megan. First, we're going to cover what your professional graduate courses will look like. The graduate program is a 3-year full-time doctoral program that encompasses 2 years of academic coursework, followed by a third year of clinical rotations. We're going to speak to these clinical rotations in more detail shortly, but to give you a few examples of some clinical rotation sites, these examples include Spalding Rehabilitation Hospital, UMass Memorial, and Shriners Hospital. Kirsten, thus far in your graduate program, could you share with us what your classes have looked like and look like currently? And could you share with us any laboratory or hands-on experiences you've had thus far?
This first year, my classes have included a lot of science-based courses like anatomy, kinesiology, and neuroscience, as well as classes like Foundations of PT Management, which teaches the clinical skills used to treat patients. During the first semester, we took an acute care course, which focused on learning the treatment and skills needed to provide care in an acute setting like inpatient hospital floors and the ICU. In lab, we have been able to practice skills like transfers, range of motion, goniometry, taking vital signs, guarding patients, and administering ultrasound and e-stim.
Kirsten, thank you so much for sharing. You mentioned many hands-on aspects of our curriculum. As our viewers know, in addition to the curriculum, clinical exposure is another very important aspect of any DPT graduate program. Our DPT graduate program allows for students to complete 3 off-campus, full-time clinical education experiences. Each rotation is a total of 10 weeks and covers both outpatient orthopedic and complex medical settings, such as acute rehab, inpatient acute care, home care, and more. This these 3 rotations also include an elective rotation in an area of interest. If you have a strong passion in an area outside of the core requirements, an elective rotation allows you to explore that more. For example, pediatrics and women's health. Kirsten, have you started to plan for your clinical experiences? Are you looking at any opportunities outside of Massachusetts?
So I'm currently in my second semester of my first year, and although full-time clinical rotations don't begin until third year, I've definitely been putting some thought into what I would like to do for my clinical rotations. When I first came into the program, all of my previous experience was in outpatient orthopedic settings, so I'm really excited to have more experiences in a variety of settings. This won't only be through the full-time clinicals, but also through integrated clinical education, which is incorporated into the program from the start. MCPHS also offers a wide variety of opportunities for clinical rotations, which can be completed in any state, not just Massachusetts. I personally love to travel and see different places, so I'm hoping to do at least one rotation somewhere that I've never been to before.
Kristen, thank you so much for sharing. You'll have to report back and let us know where you get to travel to. At MCPHS, we're proud to offer a state-of-the-art balance, wellness, and movement center, which we refer to as the BMW Center. Your classroom didactic lecture work will lead directly into this hands-on real-world experience in our BMW Center. In the BMW Center, you will be practicing what you've learned and applying those skills to the community with the support of our faculty. Kirsten, could you provide us with a glimpse of your experiences in the BMW Center?
So the BMW is a free on-campus clinic, and it's run completely by faculty and students in the DPT program. We work with a variety of patients that are members of the Worcester community, and we focus to improve their function by working on balance, aerobic endurance, flexibility, and strength. The participants are always really excited to be coming in for PT sessions, and we're very appreciative of being able to practice our skills with them. The BMW has lots of the latest PT equipment with a number of treatment tables, aerobic exercise bikes, parallel bars, and lots more. It's set up exactly like any other outpatient clinic that you may have seen while shadowing PTs. It's great to work in a realistic setting to apply the concepts that we learn in class to actually treat patients in a clinic.
Well, it really sounds like the BMW Center allows you to bring to life what you're learning in the classroom. Looking towards our 6-year track as a DPT pathway student, an important factor to keep in mind is that you will be moving campuses from the Boston campus to our Worcester campus, and understanding what the community looks like when you move to the Worcester campus is an important part of your 6-year educational timeline. Kirsten, what does the Worcester campus community look like? Could you speak to both on and off campus?
So I feel that the community here in the PT program in Worcester is very tight knit and supportive. With a small program of just 40 peers, we get to know the other students and faculty very well. The faculty have a wide range of backgrounds, so students are exposed to lots of PT settings right away. As first year students, we also get to work very closely with the second year DPT students. We're matched up with second years as mentors during our time in the BMW. And then as far as off campus, we're given the chance to shadow and work with a variety of clinics in the Worcester area. And Worcester is a fun and growing city. And with MCPHS being located downtown, there's lots of things to do right around campus.
Thank you once again for sharing. Now, interpersonal education, also known as IPE, is the hallmark of an MCPHS education. As a unique healthcare institution, you have the opportunity to work with all medical areas, really. You'll be able to interact with PA students, pharmacy students, nursing students, dental hygiene students, and so much more. Through these interactions, you learn how to cross collaborate with healthcare providers outside of your core discipline. Kirsten, do you have any IPE examples that you've completed thus far within the DPT program?
So this past fall, we had a collaborative Zoom call with all different students in the Worcester and Manchester campuses in pharmacy, PA, OT, acupuncture, nursing, and we used that time to figure out the unique skills and services that each provider could bring to a team. Learning about the other fields and connecting with peers gives all students at MCPHS an understanding of the importance of each role in a team of healthcare providers, and it prepares us to collaborate with others and provide the best possible treatment for patients.
Thank you. And looking far out for many of you folks listening, but an important part of the DPT education is the licensure. The licensure exam is very important for all students going through a DPT program. To touch upon our NPTE, or the National Physical Therapy Exam pass rate, we're really pleased to be able to share with you that our ultimate average pass rate is 97.4%. Kirsten, could you share how you're working to prepare for the NPTE and how the faculty is assisting you through this process?
Yes, so all of the tests and examinations in the curriculum are designed to prepare us for the NPTE, and the style of questions as well as the timing for each question on exams is based on the same exact format as the NPTE. In each class, rather than just learning necessary skills and techniques, We always use a case-based approach to strengthen our clinical decision-making skills, and this is to prepare us for practice, but also the NPTE as well. In the third year, PT faculty also help students to prepare by assisting with creating a study schedule, and students are able to utilize practice exams in order to ensure success.
Thank you again, Kristen. And last question for you, Kirsten. If you could give a future DPT pathway student a piece of advice, what would that be?
Advice to pathway students is to use your resources and get as much experience in PT as you can. MCPHS Boston is located in close proximity to so many PT clinics and healthcare facilities, with many opportunities to observe or work as an aide. Shadow and observe as much as you can, and enjoy it, be passionate about what you do, get involved on campus. Your time at MCPHS is going to fly by.
Thank you to all our accepted students for joining us today. It was a real pleasure to talk with you all. As a reminder, if you have any questions at all or would like to schedule a time to speak with us about your pathway program, you're always welcome to sign up for a counselor appointment at any time. We're really looking forward to welcoming you to MCPHS in the fall. Thank you.